is CGTN, China Global Television Network.
Tunisia's health minister has warned of an increase in coronavirus-related deaths in the country if people continue flouting lockdown rules. Tunisia imposed a lockdown last month to curb the spread of the disease, and as Adnan Chouachi reports from Tunis, the government has warned that those who deliberately spread the virus could face manslaughter charges.
Tunisia's health minister, Abdeltif El-Maki, has warned that people will die on the streets and in front of hospitals if citizens continue disobeying lockdown regulations.
The increase in the number of people infected with the virus is the result of the failure to abide by the lockdown and preventive measures adopted by the state. It is the failure to respect the lockdown that has caused the increase in the number of infections.
Authorities have warned that people infected with COVID-19 could face manslaughter charges if they intentionally infect others.
We will not tolerate any misconduct. The current challenge for the medical units is to define the source of infection amid the failure of suspected cases to comply with self-isolation measures. Some people provide false information that can only hamper the work of the medical units.
Many Tunisians are aware that all measures taken by the authorities against the spread of the coronavirus are aimed at strengthening social distancing in order to limit the spread of the pandemic.
I am not shocked by the government's decision to jail those who lie and transmit the virus on purpose. The state says that the next 2 weeks will be decisive in the battle against coronavirus. We must comply without any question.
The Ministry of Health says that only 30 patients have recovered so far because the virus survives in the body for a long period. Authorities say 1,590 repatriated Tunisians have been housed in quarantine centers under tight security. The director of the National Observatory of New and Emerging Diseases pointed out that no one can predict when the peak of the COVID-19 pandemic will be reached in Tunisia. She added that the most difficult challenge is to identify healthy carriers who are asymptomatic and who may be contaminants. Adnan Chouachi, CGTN, Tunis.